Good morning, everyone. Good morning. This is Dr. Taylor. It is Friday, March 20th at 10:30. And this is my first of a daily YouTube video on highlights during this COVID-19 time. I'd like people to submit their questions to me so I can address specific issues. However, given that this is my first video, I obviously can't do that. So I want to give you just a little bit of a background on me and what this will be about. So again, my name is Dr. Stephanie Taylor. I'm a physician. And around 2005, I went back to school and got my master's in architecture and engineering, because it was becoming very clear to me that the built environment is hugely impactful for people's health. And since I graduated with my master's, I've been doing research on the intersection of the built environment and human health, both in hospitals, in schools, offices, and in our homes. Added to that intersection of health and the indoor environment, we now have these amazing tools, these metagenomic analysis tools, so we can have a very detailed and specific idea of how our buildings, how they're designed, how we manage the air, which materials we choose. All of those factors, we are now becoming increasingly aware of how they impact our health, the movement of microbes in our buildings, in our air, and how those microbes then influence our health. So having said that, you might be wondering why I'm doing my video on the Condair platform. I'm very honored to be here, very honored to be working with Condair. During my research, the indoor factor, which again and again is proving to be very impactful to human health and also impactful to the microbes that live in our buildings with us, is the amount of water vapor or humidity in our environment. So this has been known for some time, since around 1985 for many of us. ASHRAE created a very impactful graphic done by Avondale and Sterling, showing that there's a very good zone of indoor humidity that benefits human beings. My research is also revealing that dry indoor air is terrible for humans, and it promotes the spread of pathogens. Pathogens meaning the viruses and bacteria that cause us harm. Okay, so let's get back to COVID-19. So here we are in December 2019, January, February, March 2020, and we're experiencing this very alarming, now called a pandemic, with the coronavirus. What is a coronavirus? So it's called that because there are these little spiky projections on the membrane that give it the appearance of a crown, at least in some people's imagination. RNA viruses are unique in that because of how their genetic material is packaged in the viral particles, when the viruses split, create offspring, there are a lot of misreading errors to that genetic code. The consequence of these misreading errors is that many mutants can be formed, many different strains. So if one of those mutant viruses finds an environment which it can live in a little bit more optimally than it could before the mutation, it then has an opportunity to proliferate or to divide and disseminate into that environment. Viruses also need living cells in which to infect. Viruses by themselves are not alive. They're genetic material. But when that genetic material finds a host, such as an animal, the viral particles can then replicate in the animal cells. In the case of COVID-19, that coronavirus mutated so that the viral particles in the animal cells could then be spread to humans. And subsequent to that, we now clearly know that the COVID-19 virus can be shed not only from animals to humans, but from humans to humans. So here we are. what are we going to do? This is a new strain. We don't have immunological memory against this COVID-19 strain. In other words, we don't have immune protection. Maybe a few people do who've already become sick and recovered, but the vast majority of us don't. So what are we going to do? So if in the United States, we've been hearing about, every state now has people with infections, the death rate is going up. We've been told appropriately to not go to school, not gather in groups larger than 10 or 50, to stay at home if we can, to work from home. Schools have been closed, don't go to restaurants. Everything we've been told is don't do. Don't go to the gym, don't go to school, don't go to work. Go to the grocery store as infrequently as possible. So here we are being told to be passive, in a sense, in the face of this very scary pandemic. But what can we do? Well, clearly we can wash our hands. We can exercise social distancing. But another thing that we can do, which is so powerful, and yet we're not really seeing adequate promotion of this by the CDC or the World Health Organization. However, it is one of the best things you can do to protect yourself. And that is humidify your homes, humidify your offices if you are going to your office. We now know that 40 to 60% indoor relative humidity is key to several factors that protect us from this disease. So firstly, research is showing that coronaviruses survive in the air and survive on surfaces. An article came out yesterday in the New England Journal of Medicine showing that the COVID-19 survives in the air up to 3 hours. I think it survives longer than that, and the article didn't specify what the humidity was. But we now know that in dry air, so when I say dry, I mean relative humidity less than 40% or especially down to like 20%, the dry air promotes the transmission of infectious droplets. So if you sneeze or cough into a dry room, those droplets shrink. They reach equilibrium with the moisture in the air. And when they shrink down to a very small size called a droplet nuclei, those organisms can spread through your HVAC system. They can spread out your window, out your door, down the hallway, and infect other people. So that's one reason that we don't want to have a dry indoor condition. Secondly, viral particles that land on surfaces actually stay activated when the water vapor content or the humidity of the air is low. Surprisingly, if you expose stainless steel surfaces and your hands to the coronavirus, you will find more viral particles surviving on the stainless steel surface than you will on your hands, probably because of the moisture and perhaps the salts on your hands. So moisture is key to inactivating coronaviruses. Now, the example that I just gave does not mean that you shouldn't wash your hands. You should. It's just an example about the role of moisture in inactivating coronaviruses. So if you keep your indoor humidity 40 to 60%, you decrease the biological burden, the viral burden of pathogens in the air that you can then breathe. You also inactivate viruses on surfaces with that moisture content. And thirdly, and this is really important and a very powerful strategy to decreasing disease. We now know, as of a great paper came out in May of 2019 from Yale Immunobiology. Dr. Akiko Awasaki's laboratory did this research showing that when you take genetically modified mice that respond to influenza, in this case, the way humans do, if you precondition some mice in 20% relative humidity and other mice in 50% relative humidity, there's a vast difference in how those mice survive and respond to influenza A infection. So what did they find? They found that at 20% relative humidity, the mice who were inoculated with influenza A, they lost weight rapidly and they died fairly quickly. But prior to their death, a couple findings were found that were very different from what happened to the mice at 50%. So at 20% relative humidity, the mucous membranes in the airways of the mice became somewhat dehydrated. The little protective cilia, the hairs that wash particles away from your lungs, were inactivated. That is sort of predictable. But what wasn't predictable were some further findings. In the mice in dry air, there was less production in their airways of interferon. Now, interferon is a protective protein that helps us fight viral infections. So dry air inhibited the production of some protective proteins. And furthermore, there are certain cells that help clean up any tissue inflammation or any damage that might occur. Some of those cells are in the higher parts of your airways, the lining of your trachea and your big bronchial tubes. Those cells were less active. The cleanup cells were less active. So those cells were not able to become repaired if they were damaged. Other cells, even deeper in your lungs, called alveolar macrophages, were also less active in low relative humidity. So putting all this together with the mice model, when the air is at 20% relative humidity, your very natural, effective, and protective immunological barriers that would help you fight a viral infection are impaired. And beyond just dehydration of the mucous membranes. Furthermore, at 50% relative humidity, so clearly right in the middle of the 40 to 60% range, at 50% relative humidity, all of those immunological protective mechanisms were optimized. The mucus could trap particles, the little hairs could wash things away from your lungs, and the cells that repair early damage worked very well. And in addition, the mouse bodies made interferon. So again, that was a mouse model. It was a mouse model that behaves very similarly to people. So in this time of uncertainty, I'm going to create the 50% relative humidity environment, whether I'm a mouse or not. How many people go take a long flight on an airplane, even prior to this outbreak, and get sick? I mean, I sometimes do. You go on vacation, you arrive at you arrive in the beach and ready to have a good time with your family. But first you have to get over a bad cold or a sinus infection. What a drag. There's not a lot we can do in airplanes right now. That's not up to us. But what can we do now? So with COVID-19, we're told, don't do this, don't do that, don't do this, don't do that. Wash your hands, yes. Stay away from people, yes. And in addition, humidify your spaces, humidify your homes. And I don't just mean put a little, pot of steaming water on your wood stove. That's better than nothing. But go to the hardware store and buy a hygrometer. It's a hygrometer, not a hydrometer. Or make one. Make a wet bulb, dry bulb hygrometer. Help you and your family understand what relative humidity is. But however you want to do it, monitor your indoor environment. You want to aim for 40 to 60% indoor relative humidity. So then what do? Your hygrometer tells you that you're too low. Then you need to humidify your home. Ideally, you have a fully installed system that operates with being regulated automatically. That's what I do in my home in northern Vermont. I have a Condair RH2 unit. It's a steam unit, works perfectly. I love it. Maybe, right now, if you're doing this emergently, you're not going to be able to do a full installation. Go to your pharmacy, go to Home Depot if you can, if they're still open, and get a humidifier. I'm not an expert on humidifiers. I don't sell humidifiers. I don't have stock in humidifiers. So there's no, I don't benefit from purchasing of these units. But I do benefit from knowing that more people are healthy and that people understand how important moderate levels of indoor water vapor are for their health. So thank you. This is going to be kind of a short video today, but please email me questions. My email is on LinkedIn, or send questions through LinkedIn. And I look forward to seeing you on Monday. Everyone have a great weekend. And please, if you don't already have a humidifier, install one, buy one, start it running. Thank you very much.